warm welcome today and the opportunity to say a few words. I thought I might say a little about why we're here, a little just about India, and then perhaps something about my job and some shared insights and opportunities for our two countries, and more than that, for Wales and Tamil Nadu within India to think about our future. So this is the first time that a health minister from Wales has been to India, and it's the deliberate opportunity in the fourth year of the BAPIO initiative, the medical training initiative that Keshav has mentioned, to support that activity, because it's a really important activity for Wales, but also I think for India too, because we now have had a pipeline over 4 years of about 100 doctors each year coming into our National Health Service in Wales, working for 2 years. They're providing direct patient care, because if they weren't doing that, they wouldn't get the proper learning and training opportunity. And at the end of that 2 years, they then return to India. So the insights and the skills, and people learn good and bad things when you learn. I certainly through my life have learned from making mistakes and getting things wrong and seeing other people do that, just as getting things right. To come back and then to be able to apply that to the health service here in India. And it's more than that, of course, because there's something about the relationship between India, Wales and the United Kingdom anyway, and not just about the many centuries of the past, but for my own responsibilities, the National Health Service was created more than 70 years ago. And it was created by a model from Wales by a Welsh politician, Aneurin Bevan. And so we're really proud of the fact that the National Health Service of the United Kingdom was born in Wales. And 70 years ago in the United Kingdom, people still faced a choice between whether to pay their medical bills, whether to pay their heating, or whether to buy food. And that was a really difficult choice for lots and lots of families. So after the Second World War, we decided to pool our resources. We decided that we would pay from taxes to create a national health service owned by the government on behalf of the people, and that meant that every single family within the United Kingdom has free healthcare. So whatever your means, whatever your social background, the National Health Service is there for you. There is no financial limit to the treatment you can have. It is simply about the ability of the health service to provide it. So it's a generally comprehensive system, and it was a really radical thing to do in the aftermath of the Second World War. And it remains a radical act to keep on funding our National Health Service, the collective will and effort that is required. And it's enormous. Just within Wales, a small but perfectly formed country of 3 and a bit million people, within the Welsh Government's budget, I spend over half of that budget, over £7 billion on maintaining our National Health Service each year. So it's a significant enterprise. It's the largest employer within Wales, so it has a significant economic reach just as a direct employer. But as all of you know, in creating and sustaining a health service, well, the health service doesn't make its own bandages, it doesn't provide all its new drug treatments, so all of that activity around the health service, there's a huge industrial scale level activity, and the sector of the economy around it. And I have responsibility for trying to safeguard the legacy, but more than that, to safeguard the future of the National Health Service. And that's where we still come back to India, because the health service would not have been created without doctors from this part of the world. The wider Indian subcontinent was really important in the creation of the National Health Service. There are large communities that would not have had a local health service as part of the National Health Service without doctors from this part of the world. So in coming back here with the medical training initiative, but in the doctors that we know have worked within the National Health Service and returned back to India for a variety of periods of time, some doctors have stayed in India too. Now, and that's part of the story. It's an international success story, the National Health Service, and in doing so, it's not just changed the nature of treatment, but I actually think that Britain, and Wales certainly, is a better place for having a wider variety of people to call that part of the world their home, and to still be proud of who and what they are. Just as I'm proud to have been born in Zambia, I'm proud to be the Minister for Health in Wales, and I'm proud that my son has heritage he can call from his mother's side in Ireland too. You can be proud of who you are and call more than one part of the world your home. And the health service is very much a visible way to see that made real. So if any of you came to the United Kingdom and you needed treatment, if you went to a local doctor, you could well see someone from another part of the world. If you went into a hospital and you needed an operation, you would almost certainly have a number of people in different parts of the world who would be helping to treat you. And so when we think about that as our past, well, the future is that as well. And for all the success that we rightly cling on to, we still have to think about what the future will be. So in prudent healthcare, now the value of healthcare, not just about how much it costs, but what is the point and the purpose of delivering healthcare? What evidence is there that it's the right thing to do? Can we be sure we're not doing harm? Are we making sure we're having the right person delivering the right care at the right time? You know, we don't want highly paid and skilled doctors doing work that someone much more junior could do, because that's a waste of their time. They can be delivering much higher value care in a different part of our system. And that requires reform, which is difficult. And it's difficult if people get used to working in a certain way, and to change that isn't always easy. You need leadership to do that, not just the minister, and I had the opportunity to meet your minister informally recently, but other people across our whole system. Not just people like the chairman who wants to enable and empower and expect people to do more and to do better, but your clinicians as well to talk with their peers, because I know, as the minister, I'd love it if everyone did what I thought was the right thing because I'm a charming young man and they should do what I think is right. But actually, lots of people in the health service are not at all interested in that. Whereas if one of their clinical leaders or peers says there's a better way of doing our job, and we can gain much greater value with the money and the resource we have, and would make our job a better job, well actually that's really powerful. So it's leadership at different levels. And we need to do something that is thinking about what Bevan said, and Aaron Bevan, that famous Welshman who created the National Health Service, he's quoted all the time. One of my favourite Aaron Bevan quotes is that the National Health Service should always be inadequate. And he didn't mean it should be a bad service that treated people poorly. He meant the National Health Service should always be looking at what it can do better. What is the next discovery, the next opportunity? How do we understand the thirst for knowledge to understand that? How do we then understand how to apply that? And when we have something that is successful, how do we then transfer that across our service? A good practice not being an island, but being expected and demanded across our service, but also that thirst for knowledge and innovation. So it's a big challenge, but it's a big opportunity. And that opportunity in partnership with yourselves is to share what we have learned in creating the National Health Service, the learning that comes back from people who work in our two countries, but more than that. And the signing of the MOU is part of that as well, about how we share what we think we can do together in the future. And in doing that, there is much not just Wales to offer, but much for us to learn. Because I see real excellence in the provision of your facilities, the investment decisions you're making, and that never-ending challenge of what next. What can we do better tomorrow to make sure that more of our people benefit in the future? So we could and should be proud of our shared past. The history of Indian physicians, not just the doctors, but also the nurses and the therapists are also part of our success story. So be proud of that, but prouder still of the choices that we will make together to improve the healthcare system both in Wales and the United Kingdom, but also here in India as well. It's a real pleasure to be here in India for the first time with my family as well. We've had an amazing welcome. I cannot overstate how delighted and humbled I am by the welcome we've had in every single place that we've been. But I look forward hopefully to coming back in the future and to celebrating more of our shared success in the world we still will choose to create. Many thanks.